Thank you. That was really a great community dialogue, emphasizing the critical need to work together. So next, we have the privilege of hearing from Carmen Hughes with an overview of the National Center for Primary Care's Health Information Technology Division. I work directly under the leadership of Carmen, and it is my pleasure to introduce her because she currently serves as the Health IT Division's Director for Hybrid Solutions and Hybrid Health Information Exchange. And as the director, she also serves with the AIM Ahead Data and Research Core at Morehouse School of Medicine's National Center for Primary Care here in Atlanta. Carmen, we look forward to you highlighting the wonderful work you've been doing.
Thank you, Phoebe. That was an excellent and engaging conversation just before. So thank you, Mayor, again. That was phenomenal. The entire 2 days have just been great, and I'm so excited to be a part of it. And I'm thrilled to provide updates on the activities and focuses here at the Health IT Division, where we're leading and creating the advancement of health equity here in the division. I've been here probably nearly 9 years and in this role for about 7. The Health IT Division is one of 4 divisions within the National Center for Primary Care. And we're under the leadership, of course, of Dr. Dominic Mack. And the division's flagship program is Hybrid Solutions, but you may know us as Georgia High Tech or Georgia High Trek. But we did rebrand a few years ago and became Hybrid Solutions. So our division, through our amazing team, and I want to flip, let's see. Through our amazing team, offers an array of services that provide education and technical assistance to primary care stakeholders throughout Georgia, the region, and the nation, where we're focused on using digital health technologies and patient care delivery. This not only supports technically, but also the academia associated with those building blocks for the necessary exchange of health information and interoperability. We want to make sure that what we're doing is aligned with the priorities of the National Center for, or the National Coordinator of Health Information Exchange, or ONC. It's really important. And I'd like to say the work that we do is really the intermediary of education and action from clinicians and other health professionals serving in small, rural, and underserved areas and communities. We know, and studies continue to show, that these clinicians and providers are often left behind and with technology in their work. So we want to make sure that we're keeping them up to date and on the forefront of regulations coming down the pipeline. Our team and our partners work together to serve in translating the information. We act as advocates. We're boots on the ground. We help through policy and proposed rulemaking areas. And of course, oftentimes we're really just a translative communication with EHR vendors when that's necessary. And that's also a big part of the role that we do. But as ONC and CMS, the interoperability rules and the information blocking rules go into effect, more and more clinicians have questions about how this impacts them. So we really kind of stand in that gap of knowledge in those areas. In addition, I'd say our education and training arm, the Health IT Division, we also formed the Health Information Exchange, which I will share a bit of with you about that shortly. We do have a team of PCMH, patient-centered medical home experts, content experts on staff, Phoebe being one. And so they focus really on the goals and the practices with the NCQA. So it's very important. So I want to show you just a quick picture of our team. These are the folks who are in the office, Morehouse School of Medicine staff. Of course, as I mentioned, we're led by Dr. Mack. I serve as the director, as Phoebe mentioned, and we have great program managers who manage our field folks, who manage our projects, and we have a phenomenal program assistant who keeps us in line and who makes sure that we have all the administrative components in place. Because as you can imagine, as a grant-funded program, we have many, many resources that we must keep track of. So it's really important that I celebrate our team. So we think about who is hybrid. As I mentioned, we were originally Georgia High Tech, and we got to start as the Regional Extension Center for the state of Georgia when the High Tech Act was enacted in 2009. And through the Office of National Coordinator, 62 regional extension centers were funded across the country. The only one here in Georgia was awarded to the National Center for Primary Care at Morehouse School of Medicine, again, Georgia High Tech. And Dr. Mack served as the PI in the life of that program. And he built a robust team of industry experts and community partners throughout the state. And through our work, really with the Regional Extension Center, we were charged to support over 5,000 program eligible clinicians, primary care clinicians in small and rural practices, Georgia FQHCs, and over 50 critical access and rural hospitals through various education and training resources. Our team of many throughout the state really targeted various deliverables from ONC, and we exceeded those deliverables in the number of successful, what used to be called meaningful use attestations over the life of the Medicaid and the Medicare programs. So, as I think about it, I was putting this together, I want to mention that a point of information was, according to the Department of Community Health here in Georgia, the Medicaid EHR incentive program paid out over $295 million to Georgia providers through approximately 10,000 applications from 2011 to the program ended last year. Nationally, when we think about this, nationally, the incentive payments for both providers and hospitals was over $14 billion. And so as they were talking about moving from paper to electronics, there was some were forthright and ready to move forward, and others, there was a lot of lag. But those funds really put money back into the practices for increased technology and investments in really patient care. Our work really in the Regional Extension Center launched us to be known as the Health IT Center for the state and beyond in recent years. And alongside with our statewide partners through funding and technology resources, we continue to provide outreach, education, and again, technical assistance to clinicians to help them meet the requirements, I'd say the rigorous requirements of the ONC and CMS programs, most notably is the MACRA Quality Payment Program through the MIPS track. And we'll mention that. We focus on practices of 15 or fewer clinicians, eligible clinicians, and those serving in rural underserved communities. So we say and we live, really, our goal is to maximize patient information management through technologies for the successful transition of value-based clinical care and models and better health outcomes. Just a bit about some of the research we're doing and education that we're doing here within the division. I'd like to highlight those. And as I mentioned, we continue to support clinicians through the programs. We know that that's really a heavy lift for our providers and small practices to attack these requirements alone. And especially now at the MIPS program for non-participation, the penalty is 9%. It started at 4, it's at 9. And so, when you think about it, that's up to 9 cents on every dollar for Medicare reimbursement. And we know this is a significant penalty for any practice, but particularly those primary care practices who are working every day to stay afloat and independent. But on the positive, payment could increase by 9% with good scoring. And that's really our North Star, and that's our driving force in partnering with the clinicians. So as I mentioned, our team consists of PCMH experts who are able really to synthesize the data of the requirements for those clinicians and engage them in quality improvement activities that drive their success in meeting the program's objectives, but also, of course, for increasing patient care and equitable care, and of course, that being the goal. We want to make sure that we also have engaging projects, and I want to mention one or two really, specifically around the Georgia Department of Public Health Chronic Disease Unit, where we have recruited small and independent primary care practices to incorporate technology into identifying patients with undiagnosed hypertension. And through this project, we work with practices on maximizing the reporting within their EHR system to capture those patients whose hypertension may have been missed or dismissed because it was not their primary diagnosis. And we've been able to help these practices integrate algorithms into their EHR. And most recently, testing for, we're actually adding testing and remote patient monitoring for recruited practices to foster improved post-visit care through the remote patient monitoring. And then speaking of algorithms, I want to mention one additional project that Dr. G, and I won't spend a lot of time on that because Dr. G mentioned it, but it's the AIM Ahead project, which is the Artificial Intelligence and Machine Learning Consortium to advance health equity and research diversity. It is funded by NIH and it's administered through the University of North Texas. We serve, as I mentioned, on the data and research course, Phoebe mentioned, and we also lead the equity engagement unit. It is a multidisciplinary project, and we will continue to be engaged in that. And it's a 2-year project with hopefully an extension as we move into more data science work with the program. So as you can see, we have many outlets for education and training beyond assistance in Georgia and beyond. So for us, moving to the virtual platform of education and training for the past 2 years has really been a benefit to us. We've had the ability to reach more people. We've always had monthly webinars. Now I think our audience has expanded beyond that because most people are home and we do have the ability to reach them where they are. We actually even have some international attendees on some of our webinars. So I want to make sure that I know we don't operate in a bubble, however. We contribute a lot of our success to our partners and the community, public and private entities for all of our patients and providers that we serve. We continue to receive funding from state and federal entities, and we also have a revenue generating services, and we've relaunched our membership model for continuous education beyond funding. So very quickly, I want to talk about our HIE. In 2014, we established our own regional HIE here at Morehouse School of Medicine within our division, connecting to our statewide regional health information network, also known as GHIN. We are one of 4 regional HIEs connected to GHIN, but we're the only one that's really open to all who want to connect. We're not limited to a geographic constraints. We're not tied to a specific health system or specialty. We're open as well to all EHR platforms. We're not tied to an Epic or Athena or Cerner or the small mom and pops. We're open to all. And over the past year, we've invested in a more robust technology platform for our engine. We have partnered with NextGen Health Data Hub. It's a US-based technology company with an international presence. You also may know them because of their EHR technology. So they've been in this field for a long time, and we're really excited to partner with NextGen. And our goal for electronic exchange really is to provide the right data for the right patient at the right time. ONC's interoperability goal is to improve the quality of care and outcomes, avoid costly mistakes, and reduce health-related costs related to health information exchange. I do want to stop and put a plug here and let you know that we currently have funding available to assist practices in hospitals, small hospitals, or to help offset the cost of connection and onboarding new practices. So if you're interested, just give us a call. We'd love to support you in connecting to the HIE. So very quickly, and through the health information exchange, we have connections that are independent with ambulatory practices, small primary care practices, rural hospitals throughout the state, as well as other entities involved in the care coordination for patients. We brought on several correctional facilities through the state in a partnership with WellPath, and we're working to connect several emergency management organizations for at the scene of point of care, because we know oftentimes paramedics will arrive and data is not available, so we want to make sure that they have access to the exchange from that perspective. We also help to create communities of care networks in areas where there's limited or no electronic data flow for the healthcare continuum. So an example would be a rural hospital to primary care provider to a specialist to a home care services and much more. We're bridging that gap of technology and the flow of data, of patient data information. We want to make sure that's available through the community health network. That's very important. We also provide aggregated records through medication for medication history, performance labs, dashboards, radiology orders, et cetera. And then through GHIN and our connection, as you see the bidirectional flow, we have connections to Grady, Emory, Children's Healthcare, and other care management organizations and specialty clinics. And last count, I think this represented over 30 million unique patient records exchanging through GHIN. And we know that the HIE really is only as effective as the data that's available. So we want to make sure that we have as much data available for the point of need. And so I just lastly want to mention that we offer other various levels really of the HIE connections. And that's all the way from admissions, discharge, and transfer alerts to portal or clinical view only, to bidirectional data flow, et cetera. And we want to again make sure that our ultimate goal around this is interoperability. So we have a multitude of services within the HIE and within the Health IT division, specifically around education and training. So thank you for the time to allow me to explain that and go over the great work we're doing. Don't hesitate to reach out to me or Dr. Mack or really any of us in the division to learn more or to participate in any of our programs. And we hope you have a wonderful remaining and phenomenal day within the Health Equity Symposium. It's been great the last 2 days, and I thank you for allowing me to participate.